We're going to talk about internal examination. So this routinely performed in assessing the progress of labor.
Ma'am, ako day si Michelle Salman, ma'am, a student midwife from Balso, Calate. Ako day ang mo assess nimo pa rin, ma'am. So, relax lang ta, ma'am, ha?
Demonstrate asepsis during the whole procedure. Put on examining gloves and apply KY jelly.
Place the patient in dorsal autonomy position. Extend the index and middle finger and flex the ring and little finger. Palm should be pointing up. Separate the labia with one hand. Insert the index and middle fingers of the examining hand carefully into the vagina. Cervical dilation is determined by estimating the average diameter of the cervical opening in one side to that opposite side. Remove the gloves and discard.
Makeup ko?
Document and explain the finding to the patient and inform the patient what to expect after the procedure.
Ma'am, na kayo mga pangutana, ma'am, or mga clarifications?
The degree of cervical effacement is usually expressed in terms of the length of the cervical canal compared with that of an uneffaced cervix. When the length of the cervix is reduced by one-half, it is a 50% effaced. When the cervix becomes as thin as the adjacent lower uterine segment, it is completely effaced. The position of the cervix is determined by the relationship of the cervical os to the fetal head and is categorized as posterior, mid-position, or anterior. Determine the consistency of the cervix as soft, firm, or intermediate between the two. Determine the state of the membranes, whether intact or ruptured. The presenting part is palpated and differentiation of vertex, face, and breech is accomplished. If the vertex is presenting, the fingers are directed posteriorly and then swept forward over the fetal head toward the symphysis pubis. The linear course of the sagittal suture is delineated. The positions of the two fontanelles are ascertained. The fingers are passed to the most anterior extension of the sagittal suture and the fontanelle is examined and identified. Then with a sweeping motion, the fingers pass along the suture to the other end of the head until the other fontanelle is felt and differentiated. Identify the triangular-shaped posterior fontanelle and the diamond-shaped anterior. Determine the location of the lowermost portion of the fetal head in relation to the ischial spines.